Hello, anatomy friends. This is Dr. Alsup, and in this video, we are going to discuss the bones and the joints of the all-important pelvis. We have a lot of learning objectives to work through, as this is a pretty complicated region. But again, these learning objectives give you a step-by-step guide as to what you are expected to describe and identify for the assessment. So we have 2 slides worth of learning objectives, so don't skip the second slide. Make sure you cover this as well. The pelvic girdle is a similar concept to the pectoral girdle, which will mean a connection between the axial skeleton and the appendicular skeleton. For the pelvic girdle, it's going to be composed of 2 hip bones and then a sacrum in the middle. The sacrum is the axial skeleton component because recall it is part of the vertebral column. We will talk a bit more about joints in a moment, but the joints in the pelvic girdle uh, and the bones will form this complete ring, which will have limited mobility, particularly in comparison to the pectoral girdle, which recall is an incomplete ring, and that allows for a greater range of motion and a little bit more independence in terms of the upper limb. The coccyx is attached to the sacrum. You can see a little bit of it right there, but it does not articulate with the hip bones and so is not considered a structural component of the pelvic girdle, but we're going to discuss it in this video due to its geographic proximity. Based on its location and structure, the pelvic girdle has many important functions that I want us to work through. So as we mentioned, it is the region that's connecting the vertebral column to the appendicular skeleton. So you're going to have limited mobility just because of the vertebral column aspect. And with this specific connection, that pelvic girdle will actually bear and transfer the weight of everything above it, so the upper limb and all the axial skeleton, to the lower limbs via the hip joints. So you can understand why there needs to be a bit more stability here than, say, with the pectoral girdle. As you might imagine, with this region being so large, there will of course be muscles attaching here. The pelvic girdle forms almost a bowl shape. And within there's lots of different organs that are going to be contained within this region. And these are typically called pelvic organs and can include things like the uterus, the ovaries, the prostate, but also urinary organs such as the bladder and gastrointestinal organs such as the rectum. Additionally, viscera, typically considered to be part of the abdominal cavity, will lie within the top portions of the pelvic girdle as well, such as portions of the small intestines or the bowels. A last function is that the inferior portions of the pelvic girdle will also serve as attachment points for the erectile bodies of the external genitalia and the perineum. So in particular, the ischiopubic rami are of importance here. So more to come in that in later portions of the course. With the pelvic girdle being an area of transition between the abdominal cavity and the pelvic cavity, we often conceptualize this transition at an area called the pelvic brim or the pelvic inlet. The pelvic brim is a ring-like edge that begins posteriorly at the sacral promontory, which is this anterior projecting edge of the first sacral vertebra. It will continue kind of laterally and anteriorly until it reaches the superior parts of the pubic symphysis. And then you'll have the same thing on the other side to get this ring-like shape. From this illustration on the right, it is visible that there is variation in shape and size of the pelvic brim, well beyond even the 2 examples that are being shown in this illustration. The pelvic outlet is more inferiorly placed and is the opening or outlet of the pelvic cavity or the true pelvis. So this opening forms that last bony exit for the birth canal region. But note that during the latter end of pregnancy, hormones will serve to relax the ligaments in this region to help a bit with loosening of the rigidity of the pelvic outlet. The boundaries of the pelvic outlet are anteriorly the pubic arch. The ischial tuberosities are going to be the lateral boundaries. The sacrotuberous ligaments are kind of posterior lateral. And then the tip of the coccyx is going to be the posterior boundary, forming a mostly complete circular outlet, which, as you can imagine, will have variability amongst individuals. Returning to the pelvic brim, it helps subdivide the pelvic girdle into two major areas, since this region is that area of transition between the abdominal cavity and the pelvic cavity. Inferior to the pelvic brim and superior to the pelvic outlet is going to be the true pelvis. Sometimes you'll hear lesser pelvis. It's called lesser because it is smaller than the greater pelvis. Although it is hugely important area in regards to obstetrics and gynecology, as well as considerations of the bladder and the prostate, of course, as well as the rectum as well, because this region houses the pelvic viscera. Superior to the pelvic brim in this kind of peachish coloration here is the false or the greater pelvis. It's called false because the major contents in this region are abdominal viscera, like portions of the large and the small intestines. But pelvic viscera may extend into this area like a full bladder or the uterus during different stages. All right, let's talk specifics about the individual hip bones. And these are formed by the fusion of three primary bones around the end of the teenage years. And we still talk about and refer to these regions into adulthood, even though they've fused into one bone. These will be the ilium, indicated in green in the image on the right, the ischium, indicated in this kind of burnt orange, and the pubis, indicated by purple. And then on the lateral side of the hip bone is a very large cup-shaped depression called the acetabulum. This is where all three bones meet and fuse. And also importantly, the acetabulum is the socket in the ball and socket hip joint. It articulates with the head of the femur. It's a really prominent structure on the lateral side of the hip bone. Let's talk about those parts of the hip bone and highlight some structures I want you to know. The ilium is the largest portion of the hip bone, and it's characterized by this fan-shaped blade that is going to be more superiorly located. The iliac crests are the superiormost extensions of the superiormost extent of the ilium. And these are like crest-like borders. If you put your hands on your hips, they are resting on the iliac crests. And the sheet-like muscles of the abdomen are going to have an attachment on these crests. The greater sciatic notch is formed by the ilium and the ischium, with maybe a little bit of the pubis in there. And this is a large notch in the actual bone. But when you add in the ligaments in this region, you can see specifically the sacrospinous and the sacrotuberous ligaments. It turns into, in essence, a foramen in this region. And this relatively large space allows structures to exit the pelvic cavity to enter the lower limb, including the largest nerve of the body, the sciatic nerve. But that is not the only nerve or vessel exiting via the greater sciatic foramen. There's also going to be a muscle that will traverse the notch called the piriformis muscle, which is an important lateral rotator of the hip joint and just a general landmark in the region. Moving posterior-inferior, there is the ischium. The major feature of the ischium is the ischial tuberosity. These are going to be really robust bony projections that are often called the sit bones because the body's weight rests on these tuberosities when sitting. The sacrotuberous ligament will attach to the tuberosity as well as the sacrum. If you break down the name, that kind of makes sense, right? As well as the ischial tuberosity is the proximal attachment site of the hamstring muscles that are located in the posterior thigh. So these are the major flexors of the knee joint, and it can also extend the hip joint. The largest foramina in the body are also located in the hip bones, which are the obturator foramina. So these are larger than even the foramen magnum in the skull. It's being occluded by the sacrotuberous ligament in the right side of this image. During life, it is almost completely filled in by a membrane called the obturator membrane, which serves as a muscle attachment site. The foramen is going to be formed by both the pubis and the ischium. So speaking of the pubis, the pubic bones are the smallest of the three. It's going to be located anterior-medially. And the symphyseal portion, so right on the medialmost edge of each one of the pubic bones, will articulate with the symphyseal portion of the other pubic bone to form the pubic symphysis. Moving to the sacrum, this is one bone formed by the fusion of 5 sacral vertebrae. The fusion actually typically begins around the age of 16, finished around the age of 30. Obviously, there's some variation there. And the superior portion of the sacrum is weight-bearing, which makes sense due to its large size, whereas the inferior portion of the sacrum is not weight-bearing, and the vertebrae get progressively smaller because of that. The sacral promontory is that anterior projecting edge of the body of S1, and recall forms that posterior boundary of the pelvic brim. Some other structures I want you to know include the sacral canal, which will extend inferiorly. And this is the continuation of the vertebral canal, and it contains spinal nerve roots arising from the end of the spinal cord. And these spinal nerve roots are called the cauda equina. And you'll talk more about this in the neuro portion of the course. But the spinal cord actually ends around the second lumbar vertebra. So you have to have these relatively long nerve roots that travel inferiorly within the sacral canal to reach the rest of the vertebrae and their exit points. Cauda equina means horse's tail, so these nerve roots supposedly resemble a horse's tail, and they kind of do. On both the anterior as well as the posterior sides of the sacrum, you will see very noticeable foramina, paired foramina. And these allow for the exit of the ventral and dorsal primary rami of the spinal nerves to exit the canal and head towards their target organs. And lastly, if you're looking at the posterior side of the sacrum, you may notice that there is an absence of the lamina or spinous process in the S5 region. Sometimes it will extend into the S4 region. And this is called the sacral hiatus. And so this is a typical thing. This isn't a pathological absence. Last but not least, in terms of the bones in this area, is the coccyx. Again, this is not part of the true pelvic girdle, but closely related geographically. This bone is colloquially referred to as the tailbone, and it's typically formed by the fusion of 4 rudimentary and atypical coccygeal vertebrae. So they lack most of the typical characteristics of a vertebra. And the first coccygeal vertebra may remain separate throughout life, but more typically, these four bones will fuse around 20 to 30 years of age. It is going to be an attachment site for muscles and ligaments, and it is a remnant of the embryonic tail-like caudal eminence. Let's finish our discussion with talking about the joints of the pelvic girdle, starting with the paired sacroiliac joints. These are very strong and they're weight-bearing joints between the auricular surfaces of the ilium and the sacrum for the most part, even though it will extend a little bit more posteriorly. And it's unique in that it is a compound joint, meaning that anteriorly it is a synovial joint, so has the typical synovial joint components. Specifically, it is an atypical plane synovial joint. But posteriorly, so kind of extending past the auricular surfaces, it is a fibrous joint. So it's a syndesmosis to be exact. So even though a component of this joint is synovial, it does have limited movement, but that's a good thing. You wouldn't want too much mobility in this joint as it's so important in terms of transmitting weight. Anteriorly, we have the unpaired pubic symphysis. Between the symphyseal surfaces of the pubic bone, you'll have a fibrocartilaginous disc in between the two structures. And so this is a cartilaginous joint. Specifically, it is a symphysis. It has it right there in its name. And there's very limited movement at this joint as well. All right, to the practice question. Where do the hamstring muscles of the posterior thigh attach proximally? Pause the video to think through this, and when ready, let's discuss. So most of these answer choices are not muscle attachment sites. The acetabulum is important in joint formation, so that hip joint, but it is not a muscle attachment site, so let's mark that one out. The iliac crest does have muscle attachments, but think about its location. It's the most superior structure of the hip region, which is pretty far away from the posterior thigh, so that's not really close. That's not right. So iliac crest is wrong. Abdominal wall muscles do attach here, though. The ischial tuberosity, well, this one is looking pretty good. It's very inferiorly placed. It's very robust, indicating a lot of something attaches there. So let's return to that one in a moment. The obturator foramen is a foramen, so not what we're looking for here. Let's mark that one out. The symphyseal surface, this is important in articulation for the pubic symphysis, but not in a muscle attachment site. So let's mark that one out as well. So all signs point towards C, the ischial tuberosity, being the correct answer. So the hamstring muscles have their proximal attachment on this structure, and that is why it is so robust. So you have some fairly strong muscles attaching there. All right, excellent. Thank you so much for your time and attention.